Back at Sunset Dental, I'm talking with Dr. Van Dyke, and we've been having an interesting discussion about headaches and how they relate to your practice. One of the things that we're talking about is this issue of grinding our teeth. And most of us just aren't even aware that we do it.
It's very true. I would say 1 out of every 3 people are aware. You know, they can sit in the chair and say, yeah, oh, I know I grind. I wake up and my jaws hurt and I have a headache. But other people, they have signs all over the place in their mouth, but they have a hard time believing that they're grinding.
I'm that guy.
Okay.
No, and it's from a previous session that we did together.
Oh,
we were
okay.
talking about this subject, and I started to pay attention to myself, because at first I thought, no, I don't grind my teeth. And then during the day, I caught myself doing it. And in particular, when I'm doing something physical or strenuous, like in the gym.
Right, and that makes sense because you're focusing. I think anytime you're focusing, whether it's that type of activity or I think I said previously, driving down the road. A lot of people do a lot of thinking when they're driving down the road and sitting at their computer working. I mean, it's a focus.
Sure.
And I think that tends to bring that on.
Okay, so when someone comes to see you, how can you tell they've been grinding their teeth?
Well, sometimes it's very subtle in the form of, what I tell people to do, I look at their teeth and I have them bring their teeth out to here, for one, because usually there's a wear pattern. Maybe there's one little tiny notch in one tooth, and if they didn't get hit in the mouth or something like that to cause that, how did that notch get there? Well, most people aren't critically looking at their teeth that way, figuring that out. And when they bring their teeth like this and slide, it's amazing. It's just like a key in a keyhole, how the teeth are fitting together.
Sure.
Another thing that we see very frequently is what's called a lingual tori. And what that is, it's a bump of bone on the back side of the jaw under the tongue.
Mm-hmm. Okay. Well, we want to get into what we do about this, but we'll have to do it in our next segment. You're watching Medical Montana.